Okay, today we're going to talk about skin diseases and disorders. All right, you need to be familiar with skin diseases and disorders so you can recognize problems. You should not diagnose. You can suggest that people go to the doctor, but you are not a doctor, but you can steer them that way if you see something that you think they should get checked out. Okay, there's two signs of a disease. You have two kinds of symptoms. Subjective, which can be felt, and objective, which can be seen. So if I look at my hand and I say, oh, look at that object there, okay, so I have a scar right there, the doctor can plainly see that object, okay? And it's very easy for the doctor to diagnose that because they can see it. But if I go in and I say, oh, I've got terrible itching and burning, they can't see that. It's much more difficult to diagnose a subjective symptom than it is an objective. So remember, an object. Examples are pimples, rashes, inflammation. Okay, and sometimes you have both, objective and subjective. Okay, 6 signs of infection. Okay, the person has pain, swelling, redness, local fever, which means the skin is hot, throbbing, and discharge. So I can think of a couple things where in cosmetology where this could be appropriate would be maybe if someone has an ingrown toenail, maybe if they have something on their face like that has gotten infected, a papule or a pustule, things like that. So you just need to be aware of that. Okay, avoid direct contact with open wounds and lesions. We don't want to do any bloodborne pathogen passing. Okay, some vocabulary. Allergy. Sensitivity with something that's normally harmless. So people are allergic to strawberries. People are allergic to all kinds of crazy things that other people have no problem with. So it's normally harmless. So no matter how good your skincare system is, somebody might be allergic to it. There's just no telling what people are going to be allergic to. Okay, inflammation. Think of flames in a fire. So you're going to have redness. Okay, chronic and acute. Okay, chronic is something that goes on and on and on and on and on. So suppose you have Crohn's disease, or you have multiple sclerosis, something like that. That is going to go on for a very, very long time, okay? Acute is when you get really sick and then you get over it very quickly. So it is brief and severe. So an example might be you get food poisoning and you're throwing up, and then it's over. So chronic, long time, acute, very bad, but very quick. Right, contagious is communicable. I think we already went over that. A seasonal disease is influenced by the weather. So, you get sinus infections in the spring. Etiology is the study of the cause of diseases, what made that disease come about. And pathology is just the study of disease. Okay, skin cancer, A, B, C, D, E. So if you have a mole, and it's asymmetrical. It's not the same on one side as the other. If you draw an imaginary line down the middle, get it checked. If the border is kind of fuzzy looking, like you can't really tell exactly where it begins or ends, get it checked. If the color changes, if the diameter of the mole is bigger than a pencil eraser, and if there's an evolution where it's changing, these are all things that could indicate cancer. Occupational disorders, they occur in employment. So we're going to be talking about when we get to the nail chapter about your finger getting really red and swollen. And the people that have that happen the most are dishwashers from being in the water continuously. Contact dermatitis. Okay, this is when you're in contact with something all the time and your skin becomes red, sore, inflamed. Every winter, I had contact dermatitis from my wrist to my elbow from being in water shampooing with the wet head touching my arm as I was shampooing their hair. Okay, irritant contact dermatitis, you're coming in contact with something that's acidic or alkaline, An allergic contact dermatitis, you are coming in contact with something such as fragrances. A lot of people have allergies to that. Lesions. Okay, you have a primary, a secondary, and a tertiary. So primary is, this is the first thing that happens. So you get a cut. And then it moves down the line into a scab and then a scar. So it's just, this is what happens first, then it's this, then it's this. Okay, primary skin lesions. Okay, the first one is not something that we think of as being a skin lesion. It's a macule. Okay, it's also called a lentigo, and it's a freckle. Okay, so I always thought of this as the plural of this is lentigenes. And I always thought, man, if you look through someone's glasses at their cheeks, a lot of people have freckles on their cheeks. So a macule or a lentigo. Can you do service? Absolutely, you can work on someone with freckles. A vesicle. Okay, so a vessel is something that will hold liquid. So if you have a cupboard and then you put a bowl on top and that is your sink, that's a vessel sink. It's sitting on top and it's holding liquid. So a vesicle is a fluid-filled elevation. So it's bumped up, it has fluid in it. The example is poison oak or ivy. Okay, do not do any service on those affected areas. It will spread. Okay, a bulla is a large vesicle, and an example would be a second-degree burn. Again, you don't want to work on someone with a second-degree burn. And then another example is herpes simplex virus, where you get cold sores or fever blisters on your lips, around your nose. Okay? Again, no service. Now, a papule is a hard red pimple that has no pus in it. Okay? So there's no fluid in it. It would just be solid material in it. And a tubercle would be a large papule. Okay, so examples, pimple, yes, absolutely, we're going to work on someone's pimples. Okay, now a pustule is a papule with pus. Okay, no service on affected areas. Okay, a wheal, I want you to think about when a mosquito bites you, you want to squeal, you know, when they bite you. So it's an insect bite and allergic reaction. So you get that bump on your skin from a mosquito bite. Yep, you can work over that. And also hives. Some people get hives if they get nervous about something. Don't work over hives. A tumor is a solid mass in the skin. It can be popped up from your skin. It can be down in your skin. It can be hard or soft. It can be stuck in one place, or you can move it around. An example is a nodule or a cyst. Lots of people get cysts. Again, don't work on this affected area. Okay, now secondary. So this is as the disease progresses into later stages of development. So the first one are scales. Okay, so this is when you're shedding your dead cells on the epidermis. An example is dandruff. Can you work on it? Yes. Psoriasis, okay, it says rough silvery scales, but I'm going to change this word to coarse, which is how it used to say it in the book, coarse silvery scales, and emphasize all those S's, and that's what psoriasis is. So just think of all those S's. Coarse silvery scales is psoriasis. Okay? Don't work on psoriasis. Okay, a crust. Okay, it's the remains of an oozing sore. We call it a scab. Don't work over a scab. Excoriation. This is a mechanical abrasion. Okay, so think of sliding down the road when you fall off your bike and it goes, and we say, oh, you have road rash. That's an excoriation. There's a mechanical abrasion that caused injury to the epidermis. A very small example is a scratch. Don't work on that. Okay, still on secondary, a fissure. Okay, example is chapped lips. You have cracks in the skin, often around your lips. Okay, so think about having chapped lips and then think about going out to eat Mexican and putting some really hot sauce on your Mexican and how that feels on your lips. It might even feel like it's fizzing as that the heat in the food is working on your lips. So fissure. Think of things fizzing on your lips when they're chapped. Don't work on it. Okay, a scar is called a cicatrix. Okay, it results from a lesion. This scar is actually a keloid. Some people tend to develop keloids, and that's when your body over heals itself, and instead of just having a little flat scar, you actually get a lumped up scar. You actually have, it gets too big. Okay, you can work on that. An ulcer is an open lesion, so you lost some of your epidermis, and a lot of times there's pus in that. You would not want to work on that, okay, on an ulcer. Okay, hypertrophies. So remember, hyper means that you have too much of something, so you have too much skin in some ways. So the first one is a callus, which is a hyperkeratosis. Remember keratin, it makes up our skin, our hair, and our nails, or a keratoma. Okay, so I might get a callus if I go out into my garden and I am pulling carrots out of the ground. So keratoma might give me a callus. Okay, so the hardened skin, the thickened skin that you get. Okay, a verruca. Anybody that's a fan of Willy Wonka and the Chocolate Factory, the original one, the girl that wanted the golden egg, her name was Veruca, and she was a real pain. And the name for what is a verruca, it's a wart. I think that was a joke that they had in the movie that most people don't know about. Okay, warts are caused by a virus. They can be contagious and spread all over the body. Do not work on a wart. So remember, Veruca in the movie wanted that golden egg, was all snobby and wanted everything. And just think of her, she's a wart. Okay, a skin tag. Lots and lots of people have skin tags. It's just those little, we call them roly moles, where it grows out from the skin and it can be easily removed. Okay, no problem with that. Pigmentation abnormalities. You have too much color in your skin in certain spots or not enough color in your skin in certain spots. Okay, melanoderma. Melanin is the pigment that colors our skin. Derma is skin. So I've got a lot of color in my skin. It's called hyperpigmentation. I've got too much pigment, and there's too much activity by the melanocytes. This is what creates the melanin in my epidermis. So I have hyperpigmentation when I go out in the sun and I get those big brown spots on my skin. Then leukoderma, remember leu always means white, derma is skin. Hypopigmentation, that means not enough of something, rather than hypopigmentation, caused by a decrease in the activity of the melanocytes. And you'll see someone that just doesn't have any pigment in part of their skin, and if they go out and get a tan, you can see quite a difference where they tan and then where they have the leukoderma. Okay, under melanoderma, too much pigment, you've got chloasma. Okay, it's a group of brownish macules, freckles occurring in one place, and they're showing the back of the hand. So when people get older, they tend to start getting freckles, big brown freckles on their hands. That's just one of the signs of aging. So I want you to think of my Aunt Chloe And we're going to imagine Aunt Chloe's about 85, and she's got lots of these macules on the back of her hand. Chloasma. Okay, moles. Okay, they can be flat or raised. We all know what a mole is. And then nevus. This is a birthmark or congenital mole. Okay, nevus, I should say, not nevus, nevus. So all of us have a navel. All of us have a belly button or navel. And that signifies that we were born from our mother. So we all have that birthmark of our navel. So remember, nevus is a birthmark. Okay, now leukoderma, I don't have enough pigment. Okay, if I'm albino, I don't have any melanin in my skin, my hair, anything. In fact, I don't even have melanin in my eyes. So when you look at me, instead of seeing that I have blue eyes or brown eyes or green eyes, you can look right through the clear cornea and you can see the back of my eye with all of its blood vessels, so my eyes appear pink. Okay, vitiligo. Okay, again, patches where I do not have normal pigment. Okay, that looks pretty much like what I have seen. My sister has this. This skin should definitely be protected. If you don't have pigment here, you're going to burn right away anywhere that you don't have pigment in your skin. All right, now we're out of diseases, we're into disorders. Okay, disorders of the sebaceous glands. So the first one is a comedone. Okay, so if I have an open comedone where I can see that it's black because all the sebum that was caught in there is exposed to dirt and different things in the air, it turns black. Okay, an open comedone is a blackhead. A closed comedone is a whitehead, so that's one that's more closed over and appears more white. Then you have milia. These are pearly white and closed keratin-filled cysts. These are hard to get out. You usually have to go to the doctor to get them out. It's a hard ball, so when you get them, if you go into the doctor and they put a little cut on your skin, it'll just pop out like a little pearly white ball in there. Very hard. Okay, so comedones are blackheads, closed or whiteheads. Milia is keratin-filled cysts. So it's actually keratin, it's from your skin. Acne, it's chronic, it goes on and on and on. It's inflammatory, my skin looks red. Of the sebaceous glands, I have things such as pimples, pustules, or cysts. Okay, so this is a hard red lump. This has pus in it, and a cyst means that it's actually developed a wall around it. And so you have to cut through that wall to get that material out of there. Like you hear people talking about cystic acne. That's the worst kind that people can have. And they need a dermatologist to open up their skin and get all that out of there. Many times you have to get the sac out of there or it will just develop all over again. Okay, rosacea. This is a common thing that you see. This is generally in older people, but younger people can also have it. Chronic, goes on and on. Inflammatory, it's red. Of the cheeks and nose, you get papules and sometimes pustules with it. This is when you'll see the people whose face is very red, especially around their nose and on their nose. And it goes on and on and on. Okay, so these people have to be careful. They have to avoid sunlight. They have to avoid spicy foods because it'll make it worse. Facials can be done on these people under physician's approval. Okay, asteatosis. Okay, so remember, whenever you put the letter A in front of a word, it means the opposite. So let's go down here real quick. A steatoma, see how close those words are, is a subcutaneous tumor, so that means it's in your fat layer of the sebaceous gland filled with sebum. So you've got a whole bunch of sebum stuck in this tumor. It's also called a sebaceous cyst. Again, it has that wall around it, or a wen. So what's the opposite of something that has a whole bunch of sebum? Well, dry, scaly skin with reduced sebum production. So this A means not a steatoma, it's the opposite. Okay, seborrheic dermatitis is a common skin rash that usually affects the scalp. A furuncle or a boil, and a carbuncle. Okay, so let's talk about these two. So a boil is like the worst pimple you could ever imagine. It's an infection of the hair follicles caused by an acute, so it's short but violent, bacterial infection. It hurts very, very badly. And if you have a larger furuncle or clusters of furuncle, they are called carbuncles. Okay, you do not want to work on these because the people would be in so much pain, first of all. So I want you to remember a furnace. You know, go downstairs or go in your house, wherever your furnace is, and take a look at it and see how big it is. Furnaces are very small. They're not much bigger than a couple suitcases put beside each other. Okay, not what you think. Then think of your car sitting outside. Which is larger? A car is bigger than your furnace. So a furnace is a furuncle is a boil, a carbuncle is a larger one, or groups of them. Okay, disorders of the sudoriferous glands. These are our sweat glands. Okay, so you've got bromidrosis, and the other word is osmodrosis. So if you take the first two letters, it's BO, or body odor. Okay, it's a medical condition. This isn't just that, you know, somebody forgot to take a bath or something. This is a medical condition that they can't help. They need help from a physician. Bromidrosis and osmodrosis, an unpleasant odor from the skin. There's that letter A again. Anhidrosis, you can't sweat. Okay, this is bad. This is you need to get to the hospital. You can have a serious illness or heat stroke if you can't get rid of the heat from your body. So this is a bad one. Okay, hyperhidrosis, too much sweat. Okay, this again is not just like, oh, I'm in here and, you know, sweat's running down my neck because it's hot in the room. This is, again, a medical condition, and there's things that people can do. They can go in and they can get Botox injected into their sweat glands, maybe like under their arms, in the palms of their hands. They might take some of them out. There's things that can be done to help control this. Miliaria rubra, or prickly heat. Remember, milia were those hard keratin-filled cysts, those white balls in the skin. So I want you to think of this as being a ball, but it's rubra, ruby red. Also called prickly heat. You get this when you are in really hot conditions. Lots of people get this. You have small red vesicles all over your body. So it's a little, remember the vessel contains fluid, and it burns and itches. You cannot work on this, nor would anybody want you to work on that. Okay, skin infections. Dermatitis. You just have some sort of inflammatory infection of the skin. So it's red and you might have pus. All the things that tell you there's an infection is dermatitis. Eczema, there's 400 forms of eczema. So it can be dry, it can be moist, it can be acute, it can be chronic. It's just kind of like a general term that the doctor will assign when they see something that fits this criteria. Okay, it's inflamed. I have eczema, it's very itchy. You might get little vesicles that you scratch open and you get a little bit of relief, but then it spreads and it gets worse. Okay, impetigo, this is something that you see in babies. Highly contagious bacterial infection. It produces a honey yellow crusted lesion. So basically they have like yellow scabs, like crusts on their face. Just something that babies get maybe from other babies, like in daycare and things like that. Highly contagious. Okay, service may not be performed on the affected area. Okay, folliculitis. It's infection of the hair follicles caused by bacteria, shaving, or clothing irritation. Basically, you have a red pimple with a hair in the center of it. Then pseudofolliculitis barba. So pseudo means false. It's not the same thing. You get razor bumps or irritation following shaving. Okay, so it's not quite the same thing with having an infection and the bacteria and everything. You just have razor bumps or irritation. So a lot of people get this, pseudofolliculitis barba, and think who always did the shaving in the old days were the barbers. Conjunctivitis or pink eye, I'm sure we've all seen that. It's the inflammation of the membrane that lines the eyelid and eyeball. Very contagious. Pink eye, conjunctivitis. Don't work on the infected area. All right, tinea, medical term for ringworm. Okay, remember tinea is a parasite. It's a plant, basically, a vegetable that lives on your skin. Sounds weird. It's not a bug. It's not a worm. Okay, you get a circular patch of blisters. Contagious, very, very contagious. Okay, caused by a fungal vegetable parasite. Okay, so that always means ringworm. Now let's look at these. Tinea capitis. Where do I wear my cap? On my head, on my scalp. Tinea fasciae, my face. Tinea corpus, on the main part of my body, my trunk. Tinea crucis, I don't even know if I'm saying that right, your groin area. Tinea manum, I go and get a manicure and I get a pedicure. So I have ringworm on my hands and my feet, And tinea unguium or onychomycosis, I have tinea on my nails. We'll go into more detail with that when we get to the nail chapter. All right, check what you know. Subjective symptoms are those that can be seen. Nope, objective. The 6 signs of infection are pain, swelling, redness, local fever, throbbing, and discharge. That sounds right. Dermatitis venenata is sometimes referred to as contact dermatitis. Okay, remember you have inflammation from being around something. Abnormal changes in the structure of an organ or tissue is known as a lesion. A freckle is a type of macule. Okay, again, that's the technical term for freckle. Chapped lips is an example of, remember that Mexican food? A fissure. A verruca, remember her in Charlie and the Chocolate Factory, is a variety of wart. Open comedones are also known as blackheads. A disorder of the sudoriferous glands characterized by an unpleasant odor, BO, bromidrosis. An infection in the hair follicles caused by bacteria. It's not pseudofolliculitis, it's folliculitis. It's not the false one. Okay, thank you.